This is a paid program sponsored by the Busch Chiropractic Center.
Hello, and welcome to Health Matters with Dr. Richard Busch of Busch Chiropractic Center. And good morning, Dr. Busch.
Hey, good morning, JJ. How you doing today?
Doing great. Thanks for being here with us. I really appreciate that. We're here today to talk about neuropathy. And I have to tell you that before meeting you, I did not know that there was a name for what neuropathy is. I knew what it was.
Right.
I've experienced some of that before. What is neuropathy?
Well, JJ, neuropathy very simply is death or damage of a nerve. Okay, so there are a lot of different causes of it. We're going to talk about that in just a few minutes. But basically, when we're talking about peripheral neuropathy, we're talking about all those little nerves that are in our hands and in our feet. Those are there so that we can sense the environment around us, and we can actually hold a pen. We can hold our coffee cup without burning ourselves, or we know that if we touch something hot, we can pull our hand away. Those peripheral nerves are there so that we can actually sense what's going on in the environment around us, and we can actually manipulate that environment without hurting ourselves. Okay, so as soon as those nerves start to become damaged or start to die, and we lose the ability to sense that feeling of holding the coffee cup or our pen, we start to lose the ability to manipulate the environment around us, and we start to see all kinds of other problems develop.
Now, is neuropathy a blanket term that covers everything, or are there different types of neuropathy?
Well, in many ways, neuropathy is a blanket term, but when we talk about peripheral neuropathy, we're talking about those nerves that are concentrated in our hands and our feet. And we're mostly talking about sensory neuropathies. But you can have a neuropathy that's actually damage to a motor nerve as well. Basically, again, it means death or damage of a nerve. There are a lot of different types of neuropathies. We've treated neuropathies in my office for years with the DRS protocol for patients that actually had mechanical neuropathy, where they had pressure on the nerves in their lower back or their lumbar spine, and it would affect the nerves that go down into their leg, both the sensory nerves and the motor nerves. And some of them would actually experience even muscle weakness as a part of that neuropathic change or that damage to those nerves. There are also different types of physiologic neuropathies as related to diabetes. Okay, so there are different disease processes that will actually cause some of those neuropathies. And then along with that, it may be a situation where there's a genetic factor or even a chemical factor that's actually causing it, which actually is more physiologic in nature anyway.
You know, I actually have a friend of mine who is complaining often of his hands and feet are going numb and things along those lines, and he does have diabetes. And I've told him several times that he needs to call Dr. Busch at the Busch Chiropractic Center and talk to you about that. So this sounds to me like it's actually kind of common.
Actually, it's very common. It's becoming more and more common as well. About half the people that are diabetic at some point in time, and it may be a little bit higher than that now, at some point in time may actually develop symptoms of neuropathy. As far as those symptoms are concerned, they may notice, as you mentioned, numbness or tingling in their hands or their feet, or both. They may notice a burning sensation in their hands or their feet, or both. And these sensations aren't necessarily just limited to their hands and feet. They can actually notice these symptoms transferring up their arms, up their legs, and in some cases they may go all the way up to their waist. Again, it's death or damage of those nerves. When we talk about the sensory aspects of those of that death or damage, basically what we're seeing is a lot of those senses that we normally would feel. The hot or the cold, the sharp or the light touch, those protective senses, they're all there to protect us from injury. Those senses start to become diminished. So we start to feel less when we touch something, but at the same time we've got a lot more pain just on general activity or even inactivity when you're just sitting around. As I mentioned, there are a lot of different types of neuropathy, and some of those neuropathies can be caused by diabetes, as we just mentioned, and some of the other physiologic causes, even something called Guillain-Barré, which is actually, in many cases, a reaction to a vaccination.
It sounds like a fancy cheese.
It really does.
Guillain-Barré.
It really does, but actually it's a pretty nasty process where somebody has a reaction to a virus or a vaccination or something along those lines, and they start to notice, in some cases they may notice global weakness where their entire body becomes weak, where they start to lose sensations in their hands or their feet or their legs. And they start to have a lot of other problems that go along with that. Some other things that will cause neuropathies are different medications, okay, which is kind of interesting to think. You know, you're taking something because you think it's going to help you feel better, and then at the same time, that medication actually creates another problem for you.
Well, sure. I think that we've all seen, every medication commercial on television where, it's a 60-second commercial. 10 seconds are devoted to the name of the drug and 50 seconds are devoted to the side effects and how sick this drug is going to make you when you take it.
Exactly. And unfortunately, the side effects of most of those medications actually are worse than what you're taking them for. things. The interesting thing about this is if you look at things like statin drugs, okay, and statin drugs are one of the most overprescribed medications that are out there.
What's a statin drug?
A statin drug is a drug for cholesterol. Okay?
Oh, okay.
So a cholesterol lowering medication.
Sure.
And
I know you're going to tell me diarrhea. Well, I know that you're going to say that.
No. I'm going to avoid saying that one today. But if you look at the side effects for statin drugs, they're everything from peripheral neuropathy.
Oh, okay.
To a process called rhabdomyosis, where your body actually starts to eat the muscles in the entire system. I actually have a patient that developed. I've got two patients right now that developed rhabdomyosis as a result of taking statin medications over time. And the interesting thing about it, what's happened is, number one, they have nerve damage, and number two, they have damage to the muscles. So they have trouble walking, they have trouble getting around. These patients are patients that have suffered with that for years. They may have taken the statin medication 10 or 15 years ago, but they're still actually dealing with the effects of that statin medication right now. And the neat thing about treatment, or the interesting thing, or the amazing thing is probably the best word that I can use about treating or working with these patients, is that although we can't make that muscle mass come back, in a lot of cases we can actually, in every case that I've used it on in my office, we've actually been able to help them regain feeling, regain sensation, and regain some of the motor aspect of what was lost as well. So basically they can start getting around again a little bit better.
So you're combating atrophy as well.
Well, to a certain extent, yes. Once the damage has been done to the muscle that way, it's been done.
Yeah.
And there are a lot of cases where we just can't do anything about it. But at the same time, if we can help those nerves begin to heal, we can allow them to become more healthy. We can actually make sure, or we can get that patient back on a normal type of a lifeline, either without the pain or without the numbness and tingling or discomfort, or at least get them to where they're actually not having as much discomfort, and or as much numbness and tingling, and where we can actually make them more active again. And it is amazing for me to see a patient that has trouble walking into my office, and they may be using a walker or even a wheelchair in some cases. And after a series of treatments, we can actually get them back to a normal lifestyle without the discomfort, and where they're actually not using the walker, or where they're just using a cane at this point as opposed to using the walker and or the wheelchair. So the results that we see with this are amazing. But some other things that actually cause neuropathies like this are different chemicals. Okay, some of the heavier chemicals in the petroleum products, or even some heavy metals, may actually cause damage to those nerves. Then along with that, plastics. Some of those fumes from plastics. But then along with that, farm chemicals, pesticides and herbicides. Those will actually cause damage to those nerves. Recently we've also heard that some of the more powerful antibiotics, they're called fluoquinones. I hope I never have to say that word on the air again. But those will actually cause damage to nerves as a result of it. As far as all of that's concerned, though, the biggest thing that we see is, and the biggest thing that we've seen for years, is that nerve damage is done, right? I mean, that's pretty much what we learned. But along with that, the changes that are taking place in healthcare as a whole are continuing to really amaze me. And so a lot of the patients that we work with who have been told years ago that you've got nerve damage, you've got neuropathy, live with it, they don't have to live with it anymore. Or we can at least help them manage it in a situation where they're going to have a lot less discomfort. We can get them back to a normal activity level, either without the discomfort or with a great deal less of it.
Now, Dr. Busch, we talked a little bit about symptoms of peripheral neuropathy, being tingling and numbness in the hands and the feet. What are some other symptoms?
Well, I don't know if you've ever heard somebody talk about the fact that it feels like they have, and these may be your friends or they may be family members, but they a lot of times they'll feel a lot of pressure on their hands or their feet, or they may describe it as feeling like they have saran wrap taped around their hand or their feet with duct tape.
Oh wow.
Okay. Or they feel like they're walking on like a real mushy, like almost like a sponge, just because you can't necessarily feel it.
Oh wow.
And so what happens as a result of that is, first of all, you can have the pain, you can have the numbness and the tingling, or even an aching, sharp shooting, severe pain at times, or burning pain. Okay, there are a lot of different symptoms that go along with this. It's not just numbness and tingling in some cases. In other cases, we talk to patients and they say, well, yeah, my only problem is the numbness and tingling. The biggest problem that we see with any of these patients, though, is that if you can't feel your hands or your feet, if you can't feel your feet, what are you going to be very likely to do?
fall.
Exactly. You know what the number one cause of death and injury for patients over the age of 60 is?
Oh, it's falling down.
It's falling down, yeah. So that's something obviously we want to make sure that we can limit if it's at all possible. And so what we're doing by working with these patients with the Busch Neuropathy Protocol that we put together over the course of the last several years, we're actually helping them get back to a normal type of a lifestyle, again, either without the discomfort and the numbness or tingling, or with a great reduction in it.
Now, when we're talking about peripheral neuropathy, I've actually heard of a couple of different kinds of peripheral neuropathy. Maybe you can make this clear for me. Large and small fiber peripheral neuropathy. What's the difference?
Okay. Well, large fibers are obviously larger fibers in the body,
Okay.
but we have several different types of nerves in the body as well. And I'm going to break this out into a couple of different sections. The smaller fibers actually deal with sensations of hot and cold. There's sensations of tingling, burning, and pain. But these are also fibers that are broken down into myelinated versus unmyelinated. Now, the myelinated fibers are fibers that are actually covered with a cholesterol coating. Okay, the unmyelinated fibers are not.
All right,
okay?
so this is like a bare wire versus a wire that has insulation on it.
Exactly. So as far as those fibers are concerned, the fibers that are unmyelinated, that are smaller fibers, deal with the hot sensations, burning, and pain. The smaller fibers that are myelinated deal with cold sensations, prickling, tingling, and pain. Okay. When we get into the larger fibers are generally all myelinated, as far as the sensory fibers anyway. So the fibers that we're dealing with there deal with the sensations of numbness. Okay, or and in these cases, a lot of times we may be dealing with a balance and that type of thing. When we get into the larger myelinated fibers, they're dealing with things like muscle strength, reflexes, that type of thing. Okay, so basically, as far as these fibers are concerned, what we're predominantly focusing on are the smaller fibers. Now, at the same time, for years, as I mentioned a little bit ago, we've been seeing patients with other types of neuropathy for years in my office, and we've been helping them with the DRS protocol. Most of those fibers are the larger fibers. Okay. Now we're actually focusing on the smaller fibers as well. And the reason that that I even started doing any of this is we would have patients that would get well, but they'd still have some neuropathic change in their feet, and they'd say, I just wish I had better balance, or I just wish I didn't have that tingling sensation in my feet or my legs. And so I started looking at different types of treatment that may be able to help them, and that's kind of how this whole program is actually developed.
Now, I've heard about these large and small fiber nerves actually dying, just no longer working at all anymore. Is it possible to regenerate those?
Well, that's one of the things that we're actually doing. Yes, they do die, okay, or they maybe become degenerative. Just like everything else, there's no one treatment that's going to help every single person that walks into the office or walks into my office. It just so happens that what we're doing at this point actually is helping them. And this is a multifaceted type of a program, okay? We're not just using one type of treatment, okay? We're not just using another type of a treatment. We're actually integrating an entire protocol together which utilizes different types of things like lasers or other therapy programs that actually may be involved. But also along with that, nutrition, okay? We've got to give the body what it needs to actually begin to heal. Along with that, we're also doing some different types of things like home therapy, where the patients are actually responsible for part of their care. Because, when we're seeing a patient, we may see them for an hour, right? But they have 23 hours out of the day to go home and screw it all up. So we want to make sure that they've been given some home therapy recommendations as well, so that we can make sure that they're actually helping us help them get better. And then along with that, like I think we talked about with the DRS protocol, I also think that the different types of things like visualization are very important as well. Because if you can't see it in your head, you can't see it out in the world around you, as far as physically anyway. And so we're actually trying to harness some of that potential as well. And that's the reason we call it a protocol, because it's not just any one specific type of a treatment. It's a whole group of them.
I have a friend who deals with some of these problems, and he's always been the kind of person that just ignores whatever health risks or health problems that he's having and kind of mentally hopes they'll go away. Is neuropathy something that's just going to walk away on its own?
Well, in most cases, as far as patients that we see, unless it's as a result of a medication that they may have been taking that actually caused it, or in some cases, from a dietary standpoint, I've got patients that actually notice that their neuropathy gets worse if they're eating a lot of sugar.
Sure.
Okay. And they're generally diabetics. But then along with that, we also have some patients that may notice that their neuropathy gets worse if they're drinking too much. There are a lot of different types of things that they can do to actually affect the sensations that they're feeling. And so the biggest thing about it when we're talking about any of this is that, again, they have to take responsibility for what it is that's causing the problem. And then along with that, if we can eliminate it from their system, whether it's a medication or a chemical that they're around or a situation that they're putting themselves in, that's going to help. But generally speaking, if the nerves are damaged or if the nerves have quote unquote died, as you just mentioned, they're not coming back on their own. They're going to need some help.
Now, let's say that someone goes to see their family doctor to complain of problems with neuropathy. What is going to happen when they go see a family doctor?
Well, in a lot of cases, their family doctor may just say, okay, well, you know what, if it gets worse, let me know. There are other cases where they may be given a medication for it. Mm-hmm. Okay, and as far as those medications, we all know the names. I don't know that I can actually talk about them really on the air or not. Uh-huh. But, as far as those medications, they're designed to help cover up the pain symptoms that the patient may have been feeling.
Sure, they're masking it.
Exactly. And in some cases, they do help. I do have some patients that actually say, you know what, those drugs do help me feel better. There are other patients that they just don't, that they may notice a bunch of different side effects as a result of them.
But is there any danger to taking these medications?
Well, we talked a little bit ago about the fact that almost every medication has a side effect that's actually worse than what you're taking it for, right?
Yeah.
Okay, so some of the side effects that these medications have are things like they may notice that they're drowsy. Okay, they may actually notice that they have an inability to pay attention to things around them. Okay, they may also notice that later on they start to develop some cognitive issues. Okay, where their memory may not be nearly as good. And the idea behind it, there have been some studies recently that have said that basically what those drugs are doing is they're going in, they're helping calm down those nerves, but at the same time, they're cleaving synapses in the brain, which actually causes us to not be as intelligent as we thought we were.
We're speaking with Dr. Richard Busch of the Busch Chiropractic Center about peripheral neuropathy and Busch Chiropractic's peripheral neuropathy protocol. Now, when we come back, we're going to talk a little bit about the Busch Chiropractic Center and what the center offers that is different.
When you're in pain, you're desperate. Low back and neck pain can ruin your life. Are you suffering from herniated or degenerative disc, sciatic pain, spinal stenosis, or any kind of back or neck pain? If you answered yes, listen now, even if you've been told you need surgery. I'm Dr. Richard Busch with the Busch Chiropractic Pain Center, and I've successfully treated thousands of patients with the DRS Protocol. DRS is safe, pain-free, and an alternative to surgery that can restore you to a normal and productive life, even if you've had failed back surgery. Surgery is not your only option.
After my first DRS protocol treatment, I had no pain. The DRS protocol has returned me to the person I used to be.
The DRS protocol is exclusively offered at Busch Chiropractic. Be one of the thousands of patients who have ended their pain and suffering with the DRS protocol. Call 260-471-4090 to discuss your personal condition. That's 260-471-4090 or visit buschchiropractic.com.
Dr. Busch is a nationally recognized expert in the non-surgical treatment of chronic back and neck conditions. Call today, 260-471-4090.
And welcome back to Health Matters. My name is JJ Fabini, speaking with Dr. Richard Busch of the Busch Chiropractic Center. And Dr. Busch, we're going to circle back in just a couple and talk about what the Busch Chiropractic Center offers that is different from what else is out there when it comes to treating peripheral neuropathy. But I did want to ask you a little bit about one of the things that causes peripheral neuropathy, and that's chemotherapy.
Yeah, actually, JJ, one of the amazing things about chemotherapy and radiation therapy is, the idea behind it is these are things that are there to help us, not only help people survive, right? And the only problem is the biggest side effect that they have, other than, there are a lot of side effects that they have, but one of the biggest side effects is neuropathy. And that neuropathy actually shows up in a lot of cases even while they're treating with it. And so you're getting this treatment, you're getting this medication that's supposed to be helping you, but it's also causing damage to those nerves. And the way that it actually causes damage to the nerves is there's a little power generating system inside of the cell. This is high school biology, by the way.
Okay.
Yeah, I don't know if you were in high school biology. There's a little power generating system in the cell. It's called the mitochondria. And basically it's making energy for that cell. I kind of think about it like AEP. Mm-hmm. Okay.
Power plant.
Exactly. And so basically there are thousands of these in every cell in our body, but they're concentrated in nerve cells as well. And what that chemotherapy does is it's actually a mitochondrial toxin, so it shuts down the ability of that nerve to begin to produce energy, okay? And this happens with a lot of different medications as well. And so what happens as a result of that medication shutting down the mitochondria, we talked about the chemicals being a problem, the heavy chemicals, a lot of other prescription medications, they're all toxins, mitochondrial toxins that actually cause that to not be able to make power. I don't know if you remember last winter, it wasn't very bad, but the winter before that was really cold, right?
I do remember that.
Okay, now what would happen if your house lost power? pretty quickly it becomes uninhabitable, right?
Yeah, it's really cold.
It gets really cold, and then along with that, also your power or your water may freeze pretty quick, right?
yeah.
But as a result of the water freezing, that also causes pipes to burst.
Sure.
And it causes the infrastructure in your house to start to break down. Okay. Well, the same type of thing is happening here. We talked about the insulators on the outside of the wire or on the outside of the nerves.
Yeah.
That myelin sheath around those nerves. Basically, what happens is that starts to break down as well. And so, if you think about it, if in your house, your water freezes, and all of a sudden it's going all over the place, right? And it finds a wire that doesn't have any insulation on it, and your power comes back on for a period of time, what's going to happen? Could burn down the whole house, right?
Yeah.
Well, the same type of thing is causing a lot of the pain that the patients are feeling because it's causing the entire infrastructure of that entire nerve to begin to break down. Okay, and that's coming as a result of the inability of it to make energy. That's one of the big problems that we have, and that's a big problem that we have in chemotherapy. It's a big problem that we have with statin drugs. It's a big problem that we have with those antibiotics we talked about, and even a lot of the other heavy chemicals that are out there.
And that's where the Busch Chiropractic Neuropathy Protocol comes into play. What is the Busch Chiropractic difference?
It's a multifaceted approach where we're using a lot of different types of treatment modalities. As I mentioned earlier, we are using different types of low-level lasers. We're using different types of in-office therapy as well. We're using different types of nutrition. And the idea behind that is if you have something that's actually a mitochondrial toxin and it's killing what that mitochondria needs to function, then we need to help give it back what it needs, right? So we're feeding it. We're feeding that mitochondria what it needs to begin to function again.
Now, you're talking about lasers.
Right.
You got me on lasers.
Okay.
I want to know more about the lasers. Now, do these hurt? How does this work?
No.
It's a laser.
No, actually, lasers are awesome.
Right.
Actually, the most fun thing about my office is we've got all kinds of different treatments in it that are there for different reasons. And what lasers actually do, there are a bunch of different classes and qualities and qualifications of lasers, but we're using a low-level, it's called a cold laser because it can't burn you, okay? And we're actually using the right intensity and the right frequency basically to help affect the photoreceptors that are on the inside of that mitochondria. So we're using the right wavelength, the right frequency, and the right intensity so that we can actually help recharge that mitochondria and make it start working again.
So you're actually specifically targeting microscopic cells.
A microscopic portion of the cell, yes.
Wow.
Yeah, it's pretty amazing. What's happening then is we're actually recharging it almost like you'd recharge your cell phone battery. The neat thing about cell phones is when you get them, you can take them out, you can use them for a week before you have to plug the thing back in, right?
Yeah.
Okay, and then after about nine months or so, what happens?
Well, they don't last.
They don't last very long at all.
Yeah.
And that's kind of like what happens as we get older and we start to damage the different cells in our body. They're not going to be as readily recharged, I guess is the best way to say it. So what happens as a result of that is that it doesn't matter what we do, we may have to do some things later on from a treatment standpoint. And this is what I talk about with a lot of our patients. They got in this situation as a result of whether it's a disease process or whether it's a medication or whatever, but that's damaged those cells, okay? We can't completely replace them. We can only help repair what's there.
Now, since you're talking about a protocol treatment, a few different modalities coming together to treat one problem, how long can someone expect to be treated using the Busch Chiropractic Neuropathy Protocol?
Usually we'll see a patient for about 6 to 8 weeks.
Okay.
Sometimes it takes longer than that. I had a patient, as far as he was concerned, he was kind of an interesting guy. He was losing his hearing. He was a little bit older. He was diabetic. And, he wanted to do a couple things, but he got to the point where he was kind of getting a little bit nervous about driving places. And the reason for that, he lived on a gravel road. And, really couldn't hear what was going on around him very well because his hearing was a little bit bad. And he really only realized that he was pushing on the gas when he'd look up in his rearview mirror and he'd see a bunch of stones flying behind him.
Sure.
That's not a safe deal.
No, that's not good.
And so as far as he was concerned, he also had a lot of trouble sleeping at night.
Yeah.
And many of these patients do. The discomfort comes on as soon as the rest of their nervous system starts to slow down. All of a sudden that becomes a lot more prevalent. And so it causes patients to very often have a lot of trouble sleeping, or they may have even a little bit of a restless legs component of the whole problem. As far as he was concerned, he wasn't sleeping at night at all. And obviously he was having trouble driving. It got to the point where his wife was pretty much going to take away his driver's license if he didn't get something done. Well, within the first 3 nights of treatment, he actually slept through the night for the first time in 3 years.
Nice.
That was pretty amazing to me.
Yeah.
But then along with that, the fantastic thing about it is that after we were finished with care at about 8 weeks, he was back to normal activity level. His gait was completely normal, which means when he walked, it didn't look like he was trying to feel his way through
an invisible maze.
Exactly.
Yeah.
So it didn't look like he was trying to feel his way through that. Along with that, his activity level got better. He started to lose weight again. He actually started to follow his diet because he started to realize, hey, there actually is something here that we can do. And he got back to a normal activity level so he could get out and go fishing, which is one of the biggest things he wanted to do. But every time he tried to stand up in the boat, he almost fell out. With that, and I think probably the next question that you want to ask is, when we're all finished with that 6 to 8 weeks, what happens?
Sure.
In many of these patients' cases, we will see them periodically just to keep things under control. And when I say periodically, it may be 4 weeks, it may be 6 weeks, it may be 3 weeks. But at that point, what we're doing is it's almost like we're filling the tank back up with gas.
Okay.
Because you're using it all the time. And so those nerves can become fatigued. Something a lot of the other patients, especially when they come in, say is, I start to notice that this really flares up whenever we start to get a storm coming in.
Sure, barometric pressure.
Exactly. That barometric pressure can affect those very sensitive nerves pretty quickly. And so they start to notice that discomfort, or they may notice they have an exacerbation, or it feels worse as a result of that weather coming in.
Is the neuropathy protocol or even the DRS protocol two things that are offered at Busch Chiropractic Center for everybody? I mean, are there people that you have to turn away? Actually,
we screen everybody out to make sure that we're gonna have the best possible opportunity for them to respond to care. Okay. So we're doing whenever a patient comes into my office, whether it's for the DRS protocol or the neuropathy protocol, we're actually doing a physical evaluation. We're doing a case history on them, and we're doing a neurologic evaluation as well, so we can determine exactly where the problem is coming from. There are some types of neuropathies that don't respond to care, and some of those deal with the genetic factors that may be present. We do also have patients that have things like there's a genetic factor that's called Charcot-Marie tooth, okay? And these patients a lot of times will see wasting in the muscles of their hands or their feet, their legs. They also notice numbness and tingling and neuropathy in a lot of cases. I've got several patients that actually have Charcot-Marie tooth that are responding very well from the sensory standpoint. So they're feeling better with that. But we still have problems with the motor aspect because those muscles, the damage has been done to the muscles, and it is genetic. But there are several other types of genetic factors out there that we kind of have to look for to make sure that that's not where the problem is coming from. Because if it is, it doesn't matter how great your treatment is, they're probably not going to respond. And that's the reason that we do the evaluations we do the case histories that we do, and we actually work to screen patients that we don't feel we're going to be able to help out.
So how successful is the protocol?
It's extremely successful. As far as the patients are concerned, most of the patients that are diabetic don't have any trouble responding to care in a relatively short period of time.
Yeah.
Most of the patients that we see have really dramatic responses in getting well and in really changing their lives. I think the last time that we talked, I told you that there's not a day that goes by that I don't get to see a miracle in my office.
Correct.
Okay. And that's really true when it comes to these patients also, the patients that have neuropathy, because, really there hasn't been anything else out there that was going to be able to help them. The medications don't help them, and in a lot of cases their side effects are worse. The only other option that they have is just to live with it. And, then it becomes a quality of life issue. The thing that we see with patients is, every once in a while I have somebody come in and they'll say, well, if this doesn't get any better, I'm just ready to, phone it in. And the thing about that is, if we can help them get better or help them experience a better quality of life, we're not only affecting them, we can really have a dramatic effect not only on their life, but on everybody's lives around them. And that's one of the reasons I feel so rewarded with what we do. And it's one of the reasons I get so excited when we start talking about this. I don't know if you can tell, but I'm a little bit high strung. and I do get excited about the results that we get, because even a couple of years ago, we were told that nerve damage is permanent, remember?
Right, that's it.
Okay. But at the same time, we're actually seeing these patients respond to care and seeing it change their lives in a manner that was never thought possible before. And so that's one of the reasons that I think that this program is so fantastic. It's also one of the reasons that I think the DRS program is so fantastic. In that situation, we're actually helping people avoid surgeries.
So what can somebody do to start this process? If they want to find out more about the neuropathy protocol at Busch Chiropractic Center, what's the next step?
Well, you can do one of two things. First of all, you can call my office. The office number is 888-471-4090, 260-471-4090. Or you can check us out on the internet at buschchiropractic.com. That's BUSCH chiropractic.com. You can fill out a request for more information. We'll send you a report there through the internet, or you can actually request an appointment or request a call back, and we'll have someone get in touch with you from there. That's probably the best place to get started.
So go online to buschchiropractic.com, fill out the form, receive some information, and if you'd like to actually come in and speak with somebody in person, just let the office know and they'll get you scheduled.
The biggest question is, what do you have to lose? First of all, we can get you a lot more information. Second of all, if we have a chance to evaluate you, I can tell you whether I think I can help you or not. And then from there, we can get you back on a normal type of a lifeline, either without the pain or with a great reduction in it. Again, what do you have to lose?
That's right. Learn more by calling 260-471-4090 or 888-471-4090 or visit the website at buschchiropractic.com. That's BUSCH chiropractic.com. Busch Chiropractic Center. No pain pills, no surgery, just proven results.